What's the difference between a therapist and a coach, and how does a client benefit?
The coach really walks the path with them. Therapy is is a session, coaching is multiple times, the way we do it, multiple time check-ins, all of that. So they complement one another really well. And I think that if people have an option to, they really should have a therapist and a coach, especially if they're just transitioning out of care.
Couldn't agree with you more, because I think there's a limit to what a therapist can do. First of all, in school, you're taught all these things about boundaries, that you're not supposed to get personal, you're not supposed to give direct advice, you're supposed to help the patient get there on their own, which is great, but then there's the practical aspect in a mainstream environment of how does someone actually do that and remember that when you're not there. So that's where the torch can be passed to a coach.
Like, how can that help you to do the work that you need to do? That's like the deep clinical work.
No, I think you can absolutely take it to the next level. I can help a patient get to the point where their self-esteem is better, where they're ready to implement things, where they looked at some of the reasons why they were stuck, and then get them to agree, and now there's going to be someone that's actually helping them to play that out. The way that it can help me is that it's going to speed up progress quite a bit. I've known providers or psychologists or psychoanalysts where someone's in therapy for years, if not decades, and while they're making progress, it's not very fast at all. Obviously, it's very slow, and it shouldn't be that long. A good therapist, hopefully, is a lot shorter, and then you move it to the next level. So I've had patients that have worked with me for a while, and I've thought, okay, I've done what I can, and I'm there now for support and helping them to maintain stability, but it'd be great if they could then move to the next step and do this independently. Absolutely. And so a coach would, I think, fill that gap.
And that's when we have most therapists reach out to us that we work with, when they're working with someone and they see that the need for that extra support piece that, okay, well, this is what I'm giving them is what they need to be doing and the things that we're working on, but there's no action taken. Well, how can you help them take the action, right?
Right. First of all, I want to note one thing. You mentioned next level twice in your answer, so thank you for doing that. I don't know if that was intentional or not, but these are the next level table talks.
I didn't even know.
But I think you guys hit the nail on the head. I think that there can sometimes you experience, especially as a coach, sort of an adversarial relationship with a therapist that doesn't see the benefit of having a coach. They see it almost as competition, or what is this person doing? And honestly, there can be some conflict there between coaches and therapists if they're not working together. But the opposite is also true, that if they are working together and there's that synergy and they're both working on the same things, or one is digging deep and having the client work through specific issues, and then the coach is helping them put that into practice in between the sessions, you can see such incredible and expedited growth in the client that sometimes just isn't possible in between the therapy sessions.
That's an excellent point. I've had a lot of therapists or psychologists that I've worked with that's exactly what they would say. This is a coach, I've gone to school, I've done all this work, and they're just trying to jump in on my territory, not understanding that you can work together.
Absolutely.
And that's what I've liked about working with the two of you, that we'll work together where I can do work with the patient, not feel like this is a conflict at all, and now help the patient really to get better. So, some examples of that would be, I've had patients that they do really need to start going to support groups, and yet they're afraid and it's very daunting, and you need someone to take them. And once they go a couple times with someone, then they're very comfortable and they realize it's been destigmatized, this is not a scary environment, they have an opportunity to get better. Or working with someone who's agoraphobic and they're afraid to leave their house, and they'll have a panic attack if they do. Now, therapeutically, I'm not going to go with them and spend the time doing that to get them out of the house, but all they might need is someone that can coach them along and be there with them to help them, and then they make phenomenal progress.
Absolutely. We often tell people, we always follow clinical recommendations when we implement into the coaching, and it allows the therapist to do the clinical work, right? Because a lot of therapists complain to me, oh, well, I'm having to help them with life skills, I'm having to help them with goals and just basic things that's taking up our whole session that we're not able to even get into, the deep clinical work. So we hear that feedback a lot, and I love that.
I think people also confuse a coach with a sponsor, or confuse a coach as just somebody who's going to be there and be your motivational speaker and get the person to do things, and it's really not. I mean, sometimes it's case managing. It's helping to connect the person with local resources, with the right gym, with the right trainer, with the the right group of friends, walking through and helping them find a job like you've done with some clients. Really diving in, doing the nitty-gritty, doing the deep work with the client, and not just coaching them based on like what we're supposed to say or what's going to get them motivated, but really walking that path of recovery with them.
Walking together, walking the journey together.
And thinking outside the box.
And we can get creative with coaching. Like we can take clients to rage rooms. We can we can really think outside the box to connect with them in a deeper way. And especially if we know the things that they're working on, like channeling some of that in the different things that we do. So it does give us just this wraparound, way to help people so much better when you have a therapist and a coach work together.